Diabetes in pregnancy. Diabetes is a condition in which your body can't produce enough insulin or use it properly. If you get diabetes during your pregnancy, or if you already had it before getting pregnant, you must work closely with your healthcare provider to manage your disease and help prevent serious complications for both you and your baby. Causes. During pregnancy, your placenta supplies your baby with nutrients and water. Your placenta also makes certain hormones that your body needs to support your pregnancy. In early pregnancy, these hormones can cause your pancreas to make more insulin than normal. Hormones can also cause your liver to make less sugar than usual. This causes low blood sugar. In later pregnancy, though, the same hormones can keep insulin from doing its job. This is called insulin resistance. As your placenta grows, it produces even more hormones, and your insulin resistance becomes even greater. If you already have diabetes, it may get worse. If you've never had diabetes, you may develop it during pregnancy. This is called gestational diabetes. Gestational diabetes is one of the most common health problems in pregnancy, but it usually goes away after you give birth. Diagnosis. If you had diabetes before your pregnancy, you've already been diagnosed. If you don't already have diabetes, your healthcare provider will test you for it between 24 and 28 weeks of pregnancy. Your provider also will give you a glucose screening test. For this test, you will be asked to drink a special glucose drink. 1 hour after you finish the drink, your glucose levels will be checked. If the test shows a high blood sugar level, your healthcare provider will give you another test, a 3-hour glucose monitoring test. If the results of this test are also high, you have gestational diabetes. Treatment. If you had diabetes before pregnancy, your healthcare provider may recommend special tests for your baby, such as fetal movement counting. This test counts the number of movements or kicks during a certain time period. Ultrasound. This is an imaging test that uses high-frequency sound waves and a computer to create pictures of blood vessels, tissues, and organs while they are working. And non-stress testing. This test measures your baby's heart rate as it moves around inside you. If you have gestational diabetes, your healthcare provider will focus on keeping your blood sugar levels in the normal range. Treatment may include a special diet and exercise. Things to remember. In early pregnancy, hormones produced by your placenta can cause your pancreas to make more insulin than normal and your liver to make less sugar than usual. In late pregnancy, hormones produced by your placenta can keep insulin from doing its job. This is called insulin resistance. Treatment for gestational diabetes may include special diet and exercise. What we have learned. Insulin resistance during pregnancy happens when hormones keep insulin from doing its job. True or false? The answer is true. When you don't have enough insulin or your body cannot use it properly, sugar can't enter your cells. Only women who have had diabetes in the past get gestational diabetes. True or false? The answer is false. Gestational diabetes happens in women who have never had diabetes before becoming pregnant.